Okay, so I would first start by checking my doctor's orders, making sure that we're doing the right thing, like the patient's room, whatnot. Hi, my name is Hannah. I'm gonna be your nurse today. Can I get your name and date of birth? Okay, perfect. And then we are going to be doing an NG tube for you today. I'm gonna do my hand hygiene. So most people think that this is gonna be a feeding tube, but this is not a feeding tube. It's gonna be suctioning. So you're not gonna be able to have anything by mouth for a little bit. So we'll make sure you get everything through IV. And if you have any questions, just let me know. It's gonna be a little uncomfortable, but it shouldn't hurt, okay? And I would close the curtain and the door, make sure they have privacy, gather all my supplies, which I need to do with me. Okay. I would make sure that the bed is raised to a comfortable height for me to work and that it's set up to a 30 to 45 degree angle so that it will go down easy. Okay, I'm gonna get the cover. We'll pull back this a little bit. Make sure. Okay, then I will give him tissues if he needed for his eyes, if they're watering, or nose, and a basin just in case they need to throw up. We'll get our tube ready. So we're going to check the length. It's gonna go from the nose to the ear and then down the xiphoid process. So this one is at 47, so I'm gonna mark that. And you could go a little extra just to make sure that it's really all the way in there. Then we are going to lubricate the top of this. Okay. I'm gonna check which nostril is better, so can you plug each nose and tell me which one's better? This side's better? Okay, so I'm gonna have you tilt your head back and just take a deep breath for me, okay? So hopefully this isn't hurt too much. Okay, and then once they start gagging or we know we've reached the pharynx, then we're gonna have them tilt their chin down to their chest and give them some water to drink. Reassuring that they're okay. If there's any cyanosis or inability to breathe, no speaking or humming, then we would automatically stop and take the tube out. So now they're gonna have chin to chest, let them sip water. We're gonna go the rest of the way until where I marked. Right there. I'm gonna grab a piece of tape and just loosely tape it. Stay with me, your best friends. To the cheek while we check for everything else. Hopefully that doesn't. Okay. And now we're going to check and make sure that we are in the stomach by checking the pH. We would also get an X-ray and make sure that it is really in place. Double check. And I would check the color, the consistency of this, making sure that it is all good. We're gonna check pH, and it should be less than 5.5. So this one is good. So that is good. So now that we know that it is in the correct spot, we're going to tape it on the nose. We don't have any, but if we, in real life, we would offer a skin protectant since this tape can be irritating. So we're gonna put it on their nose and then take this one off. And then you're gonna make sure, we're gonna measure again, make sure it didn't go out or in further, make sure it's still at the same level it was before. The tape is going to go around one way on one side. And then go the other way on the other side. Just to really make sure that it's put on there good and we can, it's all good. Okay, now we're gonna connect it to the suction. So I have our little adapter. We will grab this from back here. Oh, there was one in it. Oh, okay. And then we will turn on the suction to low intermediate, and make sure that stays in the green. Make sure that our patient is good. And now I'm gonna have him look the opposite of which nostril we put it in. So it's gonna look that way. I'm going to grab another piece of tape. And I'm gonna put that around the tubing. Grab a safety pin. We're going to pin this to his gown just to give them a little extra space so that they don't pull out. Okay, now we can look again. Then I would offer any oral hygiene if they wanted that to help with any dry mouth or anything like that, or any throat lozenges or spray just to make sure they're good. And then also make sure that your vent is above so that the oxygen is good. I would clean up everything, make sure my patient is good, lower their bed, put up the side rails, and I would come back every 2 to 4 hours and offer anything they need, see how they're doing. I'm gonna go document what I did, do hand hygiene one more time, and just make sure that everything's good.